Hi, everybody. Hope you're well this first day of September 2021. It's Tana coming to you from Bridge to Health, New Mexico at the Espanola Fitness Studio just here on Riverside Drive. If you come into the New Goodwill, stop in and see us. We're right next to the New Goodwill. Oh, I'm excited about the presentation today. It's a topic I love, and that is your connection to healthcare. So I hope you find it interesting. Comment in the comments or stop in and talk about it. There's some interesting things to talk about in this. And I hope what you get out of it is that you realize how important it is to connect with your healthcare professionals, paraprofessionals, lay people, anybody involved in your health. So that's the objective here. I'm going to share my screen with you now so that you can see my slide, and I'll come back and talk to you at the end to make sure that all the sound is going to be good here. Yeah, looks like sound should be good. Okay. I always have to double check those things or we end up doing presentations twice. Okay, yeah, here we go. Your connection to healthcare, why it matters and how to do it well. Number one, we need to define what the heck healthcare is, right? It's something that we hear on the news. It's something that we talk about, we see in the newspaper. We sort of think we understand it, but really healthcare refers to the way that a person is cared for by themselves, by family, by friends, and the system of medical providers, fitness providers, all kinds of providers and practitioners who deal with products, services, and available resources to help us sustain and improve our lives, treat and heal conditions and diseases, and help us take preventative steps to stay well. Healthcare should also be a part of our daily lives. So that definition is pretty broad, right? You can think of a curandera, you can think of a priest, you can think of a fitness instructor, you can think of a doctor, all included in healthcare. Healthcare is about doing what's good for our bodies and ourselves, caring for our cardiovascular, respiratory, and other biological systems, staying mentally alert, and managing our emotions. So we can't forget our counselors and psychologists and psychiatrists there. We're all in the business of healthcare. It affects us positively and negatively, and we can affect it positively and negatively. So this is not something outside of your interest, even if your profession is not in healthcare. This affects all of us. Does getting healthcare actually matter? Yes. Access to health services clearly has been proven to affect a person's health and well-being. Regular and reliable access to health services. Now remember, we're not just talking about clinics and hospitals, although those are very important. We're also talking about fitness facilities. We're talking about counseling services. We're talking about acupuncturists and massage therapists. You need access to all of them. Why does it matter? It prevents disease and disability when you have this access. These people can detect and treat illnesses or other health conditions. It increases your quality of life. It reduces the likelihood of premature death. And finally, it's been proven to increase your life expectancy. So if you want to live a long, healthy, happy, disease-free life, you do need to connect with healthcare. Healthcare matters to the way we all live and the way we all feel. When you have a health issue come up that affects so or your family personally. For example, a crisis like a car accident or the diagnosis of chronic disease. Healthcare suddenly becomes very important to you. But we need to understand that the broad, larger world of healthcare is often overlooked when it doesn't affect us directly. But the key is it always affects us directly. So even if your particular family is not suffering a health crisis at the moment, the lack of productivity of people in your community who are feeling sick and not going to work, who are injured and are going to work but not able to produce at 100% level, that affects us. That affects our price of goods. That affects the morale in our communities. It affects the employment in our communities. I want you to realize it always affects us. This is one of my favorite topics. Healthcare is patriotic. So for those of you who consider yourselves to be patriotic, America-loving people, this is really important. Here's why. The full competitive advantage of the United States is clearly shrinking. We're losing ground in education, science, productivity, technology, and healthcare. In fact, we are so far behind the rest of the developed world on so many measures that are related to our actual health, the efficiency of our spending, and the functionality of our system, that it's truly embarrassing. Oh, I should have expanded that chart a little bit. Forgive me, but what that chart shows, if you can look closely, is that the United States spends much more money than the next most expensive country, which is Switzerland, and then you can see how it goes down the list. Now, the irony is that our health of the people in the United States does not match the amount of money that we spend on our healthcare. Understand our national pride is at risk in the area of healthcare. Around the world, we have become known as a nation of fast food and fat people. Many will agree that the health of a nation's people is the best measure of a nation's wealth. For the country as a whole, healthcare could quite possibly be the defining factor that determines whether or not the United States remains a superpower. So be patriotic, connect with your healthcare. Speaking of being patriotic, what is the role of personal responsibility? Personal responsibility is a big American value. We believe that personal responsibility equals personal power. And each individual has the right to do what they believe is the responsible thing for them. What's important to realize in healthcare is that personal responsibility cuts two ways. Attitudes that are driven by the overarching American culture's overriding views about freedom, liberty, and the pursuit of happiness actually can lead many people to take on healthy behaviors. A good example of this is our belief in more food, more toppings, larger servings at fast food, and it's my right to eat what I want to eat and not be taxed extra on the soda, for example, on the cigarettes, for example. It's my individual freedom to eat what I want to eat. But that attitude of personal freedom is actually killing us, and it's actually taking our country down. And so I would suggest that you can switch that idea of personal responsibility, personal power, to be that you have the power to be healthy and to help your country be healthy, wealthy, and powerful. That's your challenge for the day. Americans have a misplaced sense of entitlement when it comes to healthcare. They can feel that they can behave however they want to today, for example, eating poorly or not exercising or not getting treatment, because there will be a pill to care for their ailments when they need it. But I need you to understand this is not always the case. The United States is a nation of excess. It's something that in general we pride ourselves on as a country. Of course, I am definitely stereotyping and speaking broadly about an entire country of people that has many different cultures within it. But in general, we believe the bigger the car, the better. The bigger the house, the better. The bigger the plate of food, the better. There is even an undercurrent of national pride in this. We have more choice, more toppings, and bigger servings, and we go for it more often than not. But again, I challenge you to switch that sense of personal responsibility to being healthy, not unhealthy. Okay, so that's all about healthcare in America. Here are some tips for becoming a better healthcare consumer. So a consumer of healthcare are people who use healthcare. Again, it should be all of us. Hopefully it is all of us. So to truly become a good healthcare consumer, it means becoming more actively involved in your personal healthcare. Number one, be proactive with your health. 7 out of 10 consumers feel they are responsible for managing their own health. That's good. It's more than half, right? But we need to get that last 30%, the numbers 8, 9, and 10, who don't feel they're responsible, who feel other people are responsible. So I hope that you're one of the 7 of 10. The best way to keep healthcare costs down is to stay as healthy as possible. Personal responsibility, do what you can. Do what you can with lifestyle choices, exercise, diet, and not smoking are the 3 most important things that you can do. We've talked about exercise, we've talked about diet, we haven't talked about not smoking, but just don't do it if you're a current smoker, quit smoking. We can help you with that here. So give us a call, 505-591-4200. Fourth way to be proactive with your health is to get an annual checkup. Schedule your preventive screenings, see the dentist twice a year. All of them can help you stay in front of your personal health care. Number 2, know your health insurance plan. So if you are part of Indian Health Services, this might not apply to you as directly, but it's still really important to know what services you get through Indian Healthcare. Is there a premium? Are there copays? Is there a deductible, and how much is it? What expenses are covered under Indian Health Services? Or if you don't get your healthcare through Indian Health Services, what expenses are covered through supplementary insurance? What healthcare providers are you allowed to see in your network? That's a really important thing for Indian Health Services. Can you stop at any clinic, at any hospital and get healthcare or not? Are there wellness incentives? I once had somebody point to a big, huge skyscraper in Chicago and tell me, and it was the Blue Cross Blue Shield, I'm sorry, not Chicago, Detroit. And it was the Blue Cross Blue Shield's insurance building. And they said that building was built on the health wellness incentives that people don't use from their health insurance company. We accept wellness benefits here at Bridge to Health New Mexico for free classes, free personal training, free courses. There are so many things that you can get either free or reduced through the wellness incentive through your health insurance company. All you have to do is ask them about it. Most people don't even ask. They don't even know what they can get free or reduced costs. What's the cost of procedures? Can you go in for a broken bone? Can you go in for major surgery? And what's the cost going to be? Next, know when to see a doctor. Here's what's really important. You don't want to overuse or underuse healthcare. And I'm going to give you some tips now to know the difference. Know when to see a doctor. So many things can be taken care of at home But there are circumstances that you really should go to urgent or emergency care or schedule a visit with your doctor. And here's how I'm going to teach you the difference. Whoops. There we go. Know when to see a doctor. Okay, when you have symptoms of a common cold or flu or COVID, right? Many of your symptoms can be managed with plenty of rest, fluids, and over-the-counter medicine. But if you experience any of these symptoms, call your doctor. Painful swallowing, more than just a sore or dry throat, earache, cough that lasts more than 2 to 3 weeks, persistent or severe vomiting, a fever that doesn't go down or go away. And finally, any symptom that lasts more than 10 days or gets worse instead of better. Okay, so if you have common cold or flu, now I would add here, because we're in the middle of a COVID-19 pandemic, that if you've been exposed to somebody with COVID-19 and you start having symptoms of a common cold or flu, you might definitely want to go into the doctor. Next, diarrhea, or I would change this actually to loose stool. There's a specific definition of diarrhea. Really, mostly we experience loose stools. Okay, occasional diarrhea isn't uncommon, excuse me. It's usually harmless and doesn't mean that anything is wrong. But if you experience these signs, it could indicate a problem. So these include diarrhea that lasts more than 3 days. I should have put the definition in here of a loose stool or diarrhea. I'll spare you that charming topic for next time. Black or tarry stools, blood in your stool, severe abdominal pain, signs of dehydration, which are a very dry mouth or skin, fatigue, decreased urination, confusion, or irritability. And finally, stools that are black or bloody. If you have that, go to the doctor. If you don't have any of those, it's probably okay to manage at home. Headache. We all get headaches every once in a while, but they usually go away with resting or taking some kind of over-the-counter medicine that's okay for you. But if you have a high fever, stiff neck, confusion, or trouble speaking or walking along with the headache, you should definitely go to the emergency room. However, you can schedule an appointment with your doctor if you have these symptoms, and it's okay to not have it be emergency. It's okay to go in within a couple weeks. Headaches that are different than normal, more often or more severe. If you get headaches that get worse or don't get better after taking over-the-counter medicine, or headaches that keep you from working, sleeping, or participating in activities. If you have those symptoms, you should schedule an appointment with your primary care provider. If you have a high fever, stiff neck, confusion, trouble speaking or walking, go to the ER. Digestive issues. How do you know when to go to the doctor for digestive issues? So digestive issues can include problems in the upper digestive tract, which includes the esophagus and stomach, or the lower tract, which is the intestines. If you experience any of the following, call your doctor. Feeling like food is caught in your throat or chest. Heartburn that doesn't go away, gets worse, or doesn't get better by taking an antacid or some other medicine. Difficult or painful swallowing. Hoarseness or throat that doesn't go away. Nausea that won't go away. Vomiting blood or bile that's usually a green color from the liver. Severe or persistent abdominal pain. Or constipation or diarrhea that won't go away. So digestive issues can be related to our last topic of diarrhea. Back pain. Most back pain will go away in a few weeks without treatment. It often gets better by using over-the-counter medicine. You can also apply heat or cold to the area that hurts. But sometimes it's a sign of a problem. So call your doctor if you experience constant pain or pain that spreads down one or both legs, especially if it goes past your knees. Pain together with weakness, numbness, or tingling in one or both legs. Pain plus unexplained weight loss. Pain with swelling or redness on your back, or pain with a fever. Head injury. We've all had bumps on our head that's not a big deal, but it could also cause a concussion. So stay home and look for these signs of concussion and then call your doctor if you see them after hitting your head. Dizziness or balance problems, nausea and vomiting, confusion, concentration and memory problems, feeling sluggish or foggy, sensitivity to light or noise, sleep problems, or mood changes. Menstrual problems, when to connect with healthcare. A woman's period can have a big impact on her life, especially if there are problems. So if everything is normal, seems to be normal, no need to go into healthcare. But if you experience these symptoms, you should definitely call your doctor. If your period is suddenly irregular, if you don't have a period for 3 months or more, if you're bleeding a lot between cycles, or you have a period that lasts much longer than usual or is heavier than usual, or severe or disabling cramps. Mental health issues. We talked about mental health being a huge part of healthcare. So having issues with mental health is common and treatable. Be sure you call your doctor if you're experiencing any of these signs. Feelings of depression or sadness that won't go away. Extreme highs and extreme lows. Excessive fear, worry, or anxiety. Withdrawing from social interactions. Changes in eating or sleeping. Inability to cope with daily problems. Delusions or hallucinations. Substance abuse, or thoughts of hurting yourself or others. Definitely connect with healthcare. And lastly, other symptoms that you definitely should call your doctor, but they don't fit neatly into any of those other categories. Dizziness or feeling like you're going to faint, shortness of breath, irregular heartbeats or rapid heartbeats, weight loss that can't be explained, fatigue that won't go away, severe sweating, especially cold sweats, swelling in the ankles or legs, a rash together with a fever. A fever is defined as 100.4 degrees or higher. A new or changing mole or other skin change that concerns you. If you have those, definitely connect with your healthcare provider. And then just a few more things to consider here. Number one, go see your healthcare provider once a year when you're feeling healthy. Why? How often you see your doctor depends on your health. So when you decide to call your doctor or not depends on other issues that you have going on. So for example, if I have a cut on my foot and I am not diabetic, I might treat that at home. But if I am diabetic, I might decide to go to the doctor because, as you know, it's harder for wounds to heal on the feet if I have diabetes not well controlled. Okay, so what do you ask your doctor when you're finally in the exam room? You should tell them, I have a chronic condition. How often should I be in here? How often should I connect to healthcare? Once a week? Once a month? 2 times a year? Once a year? Ask your doctor. Ask them, what risk factors do I have that could determine whether or not I need to be seen? And are there any specific symptoms I need to watch out for? And this is true if you have a chronic condition or you don't have a chronic condition. Ask these questions of your doctor. I definitely suggest that you dedicate a notebook or app on your smartphone or computer to write down questions that you have before going into the doctor's office. Then be sure you have it with you and take it out to use to help you remember questions when you're in the exam room. Then use that same notebook, write down answers to those questions along with other things that your doctor or providers tell you. Remember, it's your body. How are you taking care of it? It's the only one that you've got, so use all your resources. That should have been a period at the end there, not a comma. Maybe we're continuing a little bit later. All your resources include healthcare and personal responsibility. All right, guys, hope you enjoyed those ideas about the importance of connecting with healthcare and how to be a good consumer of healthcare to make sure that your connection is all it can be. Because healthcare can make or break your life and the life of your family. So if you don't know how to connect with healthcare around you, contact me, contact other people in your community. There are a lot of people out there to help you connect well with your healthcare providers. Have a wonderful day, and I will see you guys sometime in the next couple of weeks doing something. Be healthy. Bye-bye.